Why do dermal fillers migrate, and what is pillow face? Now, these are really common questions that we get, particularly for first-time patients, and I understand why. If you're walking around London and you're thinking about getting an anti-aging treatment or a dermal filler treatment, you know, sometimes you might see someone and you might think, oh gosh, they look a little bit unnatural. Have they had dermal fillers? Is that what dermal fillers is? And then that might stop you there and then, and you might think, this is something I never want to do ever again, because you've seen something that looks very unnatural. Now, I completely understand why that might be scary, but I just want to provide a bit of context and a bit of information that might be useful in helping furthering your understanding on dermal fillers, why and how that can happen. So, for migration, there are a few main reasons why this can happen. Firstly, it's going to be incorrect technique that's being used. So, if you're using the wrong type of filler in the wrong layer of tissue, you've got different layers of fat within your face. You've got your superficial fat and you've got your deep fat. Now, your superficial fat is the one just under the skin and it's made to move. So if you were to put something quite thick in that layer, every time you move you would see it and it would look very unnatural. Whereas if you were to put something that's been specifically designed to be in that layer of tissue, it's more stretchy, so you don't see it when you move. And that's all to do with the cleverness of the chemistry of the product. So the right layer in the right product in the right layer is very important. If you were to use something deeper down in the deep fat, which is very static, so if you were to use something in the deep fat that was made to be in the superficial fat, it would barely make a difference, because actually you wouldn't get the projection that you're trying to create when you're targeting the deeper areas. The deeper areas are where we lose bone volume and we lose deep fat. So we need something that's going to be more structurally strong and robust, because it needs to project to help support the area a bit more. If you were to use something too thin in those areas, it just wouldn't do anything. So injecting the right thing in the right anatomical space is really important. This already leads into correct product choice, and I really sympathise with patients in the UK, because when someone signs up for a dermal filler treatment, they don't know what they're getting. So with dermal fillers in the UK, there are about 200 brands of dermal filler. Out of the 200, about 195 are just not good enough. And I say this as someone who runs an academic mastermind group within London, where we've got a collection of doctors who all work together and we publish research together. Now, there are some brands of filler out there which are quite notorious amongst us, because when we see patients who come in with complications, it's always the same brands of filler that keep coming up. Now, with these specific brands of filler, the reason they're causing complications is their chemistry is rubbish. And when we reach out to these companies and ask for their evidence base, for us to look a little bit more into their data, they just don't reply. So when this type of thing exists in the UK, it's quite scary for patients, because there are certain types of fillers out there which don't have the clinical evidence, aren't stored appropriately, don't come from a medical pharmacy, and actually have no place being injected into your face, and they exist, which is very scary. But the opposite end of the scale is going to be the medical grade dermal fillers. Now, these are ones that have got a lot more evidence base, a lot more research behind them. I'm not here to knock different brands. I'll just name some of the big ones. They're going to be, for example, Teoxane, which we use a lot of here, Juvederm, which we use a lot of historically. There's Vivicy, there's Restylane, there's Bolotero. These are some of the main big brands of dermal filler that have strong evidence bases behind them and come from medical grade pharmacies, which is great. Now, even between them, there's slight differences. And the reason that personally I quite like Teoxane is for two reasons. One is going to be the longevity. Now, all of the medical grade brands will say the longevity is going to be, roughly speaking, let's say 12 to 18 months for a cheek treatment or a chin treatment or something like this. Now, from my experience, Teoxane's longevity is going to be closer to the 18-month mark, and that's great for my patients, because it means less appointments for them. It means less, more time between appointments, and they can probably stretch their budget a bit more, because it's lasting a little bit longer, so they can achieve more with their treatment, which is good. That's what I want for them. I mean, with other brands that I've used, in my own experience, it didn't last quite as long. So that's going to be one thing that I really like about Teoxane. But the second thing is the type of hyaluronic acid they use, resilient hyaluronic acid. The chemistry is all based on movement. Now, to specifically answer the question on migration, which is the subject of this video, when you smile, what you want is you want the hyaluronic acid to move like this, and then contract like this when you relax. And you want that to happen all the time. With bad quality filler, what happens is you smile, it then breaks, it moves in different directions, and when that happens across 1,000 particles, then draw fluid to each particle, that's what causes puffiness. So if you're seeing someone and you think, gosh, look at all the migration there, or look at how puffy things are looking, or pillow face, or all of these things, they're all related to the same issue, because a lot of those people would not have wanted that type of look, potentially. That's probably not what they wanted. It might be, but for some it might not be what they wanted. But what's happened is the quality of dermal filler used is one that has not resisted motion, and the face is very mobile. So you need to have one that resists motion because it's very mobile. So over time, this movement that's happening is causing a breakdown in the chains, which is causing the overall swelling and puffiness that you can see. And that's why it's commonly in cheeks, because there's such a mobile area, or in lips, again, because it's such a mobile area. So we've discussed anatomy, so using the wrong thing in the wrong layer. We've discussed quality of product, so some are going to be much better than others. For that reason, by the way, you should always ask your doctor what has been used and can I have a sticker? Because with every single box of dermal filler, you receive a sticker, and that's got the lot number, expiry date, and what's been used. And that's important information, because so often I'll say to a patient who's a first-time patient here, they'll say, oh, you know, I've had this treatment before, I had my lips treated, I don't like it, can you undo it? I'll say, okay, sorry to hear about that previous bad experience, what was used? And I'll never know. And I understand why they don't know, because lots of people don't share that information. But our ethos is, you know, we should be proud of what we use, and I want every patient to know what I've used, because if they're going to be, you know, seeing someone else in the future, or if they're going to, you know, if they keep coming back to us for a long term, I want them to have the peace of mind that they've had what I believe to be the best type of treatment that I could possibly give that patient. So it's important for the doctor that you see to be happy to give you the sticker about what they're using, because it means they're proud of what they're using, and that's important. So you can always ask for that information, that should always be there. The last reason why people can get migration is going to be injecting too much. So if you put too much volume into a certain anatomical compartment that can't handle that much volume, it can spill out. So you see this quite a lot, and there are certain techniques that lend to this a little bit more than others. For example, the Russian lip technique for a lip filler treatment. Even with that type of thing, if you're using the right filler, it's more high risk of migration because of the technique. But volumes, so if someone, I mean, I'll have a patient who might say to me, you know, these are what my lips look like now, and this is what I want them to look like. And if it's a big difference in between, I would never suggest trying to achieve that type of result in one go. So with natural lips, it's not just about natural looking lips, it's not just about size. Size is one factor, but you could add 0.5 ml to your lips and they could look unnatural if it's not done correctly. If the proportions aren't respected, if the wrong product is used, you could just go for just 0.5 ml and it could look super unnatural. By the same token, you could have 2 ml injected into your lips and it could look beautifully natural if there's no migration, if the right quality of product has been used, if you're in the right layer, and if your anatomy and proportions are respected. Having said that, personally, I would never inject 2 ml in one go in someone's lips, because I always want to reduce the chance of migration. Typically, when you treat someone with lips, the soonest that you'd review someone and treat them again would be about 2 to 3 weeks. So if somebody wanted to add more volume, fine, you could do it in 2 to 3 weeks. Some practitioners might do 2 ml in one go. I would rarely, if ever, do that. So I would like to have at least 2 to 3 weeks between them. Ideally, more like 3 months, because we're just giving the body time to heal, time to recover. We're reducing the risk of migration, we're reducing the risk of any complications or anything going wrong. That's my outlook, because when I see a patient, what I want to give them is the smoothest journey possible. Obviously, it's a bit challenging if I'm just seeing someone who's only in the UK for 2 or 3 days and this is their once a year treatment plan. So obviously there are occasions where it might be a little bit challenging to do that type of thing. But if I was going to do things on my timeline of what I think is best for the majority of patients, it would be slowly and steadily over time and not too much in one go. Just a general ethos and philosophy for dermal filler treatments is it's really good to start subtle, because if you start subtle, we can always add to subtle later on. So it's very easy to build subtly over time. Whereas if somebody has too much, or that there's too big a change, or it's more than they wanted or needed, it's a lot more of a problem trying to reduce it than it is building up slowly and steadily. So if your priority is kind of You can never guarantee a result with dermal fillers, but if you want more of a sure thing, slow and steady is going to get you there, as opposed to a huge transformation. Even if you're talking about something like the lips, because let's imagine somebody had 2 mil in one go, they loved it at the time, but then it migrated a month or two later. What's the point? You're just creating a very stressful journey for a patient who ultimately won't be happy long term. They might have been much better off having 1 mil, leaving it 3 months, another mil, reduced risk of migration, and everything would look much better and more natural long term. That's my outlook on it, which I wanted to share with you. So to summarise what we've discussed, we've been talking about migration overall, the reasons why it happened. Most importantly is going to be down to quality of filler, but then also the anatomy and the injection technique really matters. And it's not just, I always say this to every patient, when they receive a treatment, it's not about how it looks today. It's not just about how it looks. I mean, when they get a treatment, the full result might be in about 3 to 4 weeks. So if they're really happy today, that's great, but it's more important for them to be really happy in 3 or 4 weeks. And it's most happy for them to be happy in 1 year, 2 years, 3 years. That's the best way to think about these type of treatments. It's not a quick fix for an immediate thing that looks good now. It's more about how are these treatments going to help you over a long period of time. And in my opinion, that's the best way to think about it. I hope you found this useful and educational. If you've got any questions, please do get in contact. I'd be happy to help you. Thank you.